the app for almost all of its inpatient care.
Preston, why do you like making these pillows?
Because we like making them because we make them for children in the hospital that are sick.
Isn't he just like the most adorable little boy ever? It was 2 years ago. We shared this young boy's inspiring story. When Preston was just a little baby, he got a severe case of bronchitis and he ended up on life support. Several surgeries later, he's now recovered, and now he gives back by sewing pillows for little kids who are in the hospital. Well, today, his family has now taken on a new mission for those who are working in the hospital. Instead of making those pillows for patients, they're now helping the healthcare workers themselves, and they're making little masks for all those doctors who are in the hospital. Heather Moore is working from home right now, and she joins us with this feel-good story. Heather, I truly do just adore this little boy, his family, and what they're doing.
Aren't they wonderful, Brandon? They are so giving of their time and of their talents, as you well know. You met them a couple of years ago, but with just a needle and thread, they are sewing a small sense of comfort for those in harm's way.
The steady sound of a sewing machine, weaving together a little peace of mind, one stitch at a time.
I've just been told that whatever they're getting, they're thankful for.
Laura Kupper and her mom, Jane Michaels, have a new purpose these days, making masks for healthcare workers in light of the nationwide shortage.
I have a friend who's a nurse. She said they're running low on PPEs. Yes, these aren't the N95s, but they're helpful for something because most of our nurses and medical staff, they're not getting the proper equipment they need to keep themselves safe. You cut the fabric and you measure it up.
The industrious women found a pattern on YouTube and got to work.
And then you sew it together and then you put it in the elastic band.
They have the know-how and the material from their successful nonprofit, Pillows from Preston. They started it 7 years ago after Laura's son was on life support as an infant with severe bronchitis. Nurses went crazy for a friend's handmade pillow in the hospital, so the family began making the comforting cushions for kids all over the world.
We haven't given up. We've been doing this for 7 years with pillows, and right now we're kind of halting with the pillows. We have a whole room full of pillows ready to give once the lift is off.
Right now, the hospitals aren't allowing visitors, let alone donations, so the family is tailoring their talents to the times.
If this is the only way I can help, then I'm going to help this way.
And they're not alone. She says elastic has been in short supply.
Either today or tomorrow, and we're getting over about 200 yards of elastic. And I have an aunt in Iowa who also does these pillows, and she's also making masks. So it's not just here, it's everywhere. And if we're all isolated in our house and we have a sewing machine, why can't we just come together and help them out?
The colorful cotton creations go to her friend, the nurse, who says they're in high demand with her coworkers.
She was so thankful just to have something to help protect her. And they are reusable, rewashable. They can rewash them after every shift, and they can take them home with them.
Little Preston, now 8, super shy in front of the camera this time around. But his mom didn't hold back with her hope for everyone, while our routines are coming apart at the seams.
Stay home. The more we stay home, the sooner this will be over.
So Laura says when she posted a picture of the mask she made on social media, people started asking for them, offering to buy them from her and pay for them. She said that she and her mom are making as many as they can right now. They're not taking a dime. So if you want to check out their website, maybe donate to them, you can check out our story. We put it up for you on our AZ Family News app.
Yeah, and you know what, Heather? They actually gave one to us. We wanted to see the quality of it, feel the texture of it, since we've done so many stories on it. It's absolutely fascinating what they're able to do, and I got to say the quality of these are pretty darn good. And I know that there's a lot of people out there and viewers who are saying, well, these masks, they're not safe, they're not the same quality grade. But you know what? In a time of crisis, you got to do what you got to do. And a lot of the nurses who have called this family, Heather, said, hey, we'll take something. It's better than nothing.
And they've got, I want to mention, you've got it in your hands there. The reason why you feel like there's quality there, they've got cotton on the outside, but they've got a couple layers of flannel on the inside. So there are several, what they call filters there in place. So technically, yes, they are not the certified masks that doctors should be wearing in the ER. Looks good on you.
Yeah, I put it on for the reason to show how much of the face it actually holds.
and how tight it is to the face to not allow droplets to get in through the sides.
Right. Well, it certainly, I think, makes you feel better that you're doing something. They said having those masks was better than nothing at all, right?
It absolutely is. And again, just a big shout out to Laura and little Preston. And that family has been through so much in their lives. And I just love that every single time they are called upon to pay it forward, they're the first ones to do it. Heather, it's so good to see you, my friend. We'll see you soon, hopefully.
I'll see you in about an hour, and then you please take some rest next week. I'll relieve you.
Yes, thank you. I appreciate you for that. Well, baseball, it is on hold right now, but jerseys are now being put